We were talking about, well, at least strides before the Supreme Court. You have two TROs already lifted. But I'm wondering on the local level with the LGUs, if you're still having any problems. For example, Manila for a long time had a very pro-life policy, and I'm wondering how that would be reflected.
And we went against that. We remember Atienza's order prohibiting the provision of contraceptives to the Manilas. But one reason why we wanted the law to be there is so that everybody should follow the law. There should be no exemption. It's we wanted to institutionalize the services and the education, and it should happen. But unfortunately, at the local level, because the services, our health system is devolved. And so the LGUs do not take orders from the Department
health
of
center,
Health.
Bali, diba? Health center sa
so, what's happening is that there is an even implementation of the law at the local level. There are many LGUs who are very pro-RH and they really want to implement the law.
Which are these? Maybe you can tell.
Marami.
In Metro Manila?
In Metro Manila, Manila is implementing.
Is now implementing.
Yes, it's now implementing. Quezon City is. Actually, the whole of Metro Manila.
Okay.
Meron lang unevenness in terms of what services are provided and how they're doing it.
Is it due to resources or political will?
Some are due to political will. For instance, we know that in some LGUs, they still don't want to use implanon or subdermal implant, things like this. And so, what the CSOs are doing, like ours, is that we deal with the LGUs as much as possible. For instance, the SWP has some memorandum of agreements with some LGUs in terms of helping out in the provision of family planning services. We have one in Laguna, we have one in Mariveles, Bataan. These things are done. But also there are LGUs that are anti and therefore they create problems in terms of the implementation.
There are some LGUs, we admit, that are not supporting the implementation of the RPRH law. For example, in Sorsogon, we will not name names, but there are LGUs there that are not supportive in the implementation of the law. But then the DILG has issued 2 memorandum circulars, and we're happy for that. They supported, the first that they issued is about the in support to the full implementation of the RPRH law, because that has been the advocacy of the President during his State of the Nation addresses.
Sir, when you say they're not supportive, to what degree are they not supportive? I mean, talagang walang bawal magbigay ng contraceptives? Give us concrete examples.
In the case of Sorsogon, they declared that the Sorsogon City is a pro-life or a natural family planning provider only. So
Is
they
that
do not
possible
provide.
under the law?
It's not, because under the law, it should be
it's
all the
national. It's a national
it
policy.
should be all the available family planning methods,
but that's
whether natural or artificial.
That's why I'm intrigued by kanina you introduced the term of the conscientious objector. And there were 2 levels there. On the one hand, conscientious objector would be the service providers, doctors who don't want to do this, BHWs who don't want to do this, and so on. But they're obligated to refer to somebody who's more comfortable. But then you also mentioned it in the context of local officials, particularly the Supreme Court saying you cannot penalize. So how do you now compel local officials, mayors, councilors, barangay captains, and so on, if on the one hand they can take themselves out of the law, but at the same time walang penalty?
But it should be taken to the context that once they declare themselves as consensus objector, they have to pass it on to another person in the local government in such a way that all the constituents who wants to use, for example, family planning, they should not be denied from having those services.
Yes,
That's
but-
as a
Well,
person.
this
Yes,
is
but
the
what-
reason
what-
why I said
Yeah,
that the
so-
law has been weakened.
Yeah, so in that
You know?
case, the chief of the local government should not hinder. So in other
Yeah.
words, if he or she is a conscientious objector, then he or she should not
Stop or prevent
stop
the distribution, for example.
Yes.